we'll wait for 2 minutes, Srinivas, then we'll proceed.
No problem, sir. No problem.
Just 2:05 will start.
Yes. Hi, Sunil.
Sunil is there. Sunil. Dr. Sunil?
I'll wait. Don't worry.
No, he's just talking about it.
Hi,
Yes,
Sunil.
Sunil, you are mute.
Hello, sir. Good afternoon.
Good afternoon, Sunil.
Good afternoon, Dr. Balaji.
Good afternoon. Good afternoon.
Hi, Balaji.
Sir, good afternoon, sir. Good afternoon.
We'll start with the things, Dr. Srinivas.
Sir, just
Yes,
2
sir.
minutes, sir.
Yeah. Other people are seeing the YouTube link they have given.
1 minute, sir.
It will be streamed in the YouTube also.
Okay.
Yes, sir.
Let's start, Srinivas and Dr. Balaji.
We'll start, sir.
We'll start now. It's 2:05, 2:06 now. 21 people are there in this line, and other people will join in the YouTube.
Yeah.
So, shall we start, sir?
Yes, we'll start. I'll talk, then I'll pass it to you. Is it okay, Dr. Balaji?
Right, sir. No problem.
A very good afternoon and namaste to all. I welcome Dr. Srinivas Namneni, President, FSCD, and Dr. Balaji, Executive Committee member of FSCD, and Dr. Sunil Babu, who is a speaker for today, and he is Autism Board member too, and all the interested people in this webinar, as well as who supports this program. I welcome all you for this today's interesting program of nutrition, a puzzle to be a solid for autistic children. And we have this month as considered as Autism Awareness Month, and we have conducted many programs in Mangalore as well as in Greater Noida. Just we have finished 2 programs yesterday too, and some other programs are lined up in the 2 weeks of this April month. And with this, I welcome all for this webinar, and please, I support this program and take the awareness to the autism awareness to the people, and let the people get benefited by this. And I hand over to Dr. Balaji to continue the program, and after that, Dr. Srinivas can talk for today's webinar, and Dr. Sunil will continue today's webinar. Thank you. Namaste to all.
Thank you, Dr. Shambhat, sir. Indeed, it's a proud privilege to be here today for the program of Autism Board. And we are very happy to note that under your leadership, the Autism Board is conducting so many programs in the past few weeks. Hats off to you and hats off to the board, sir, for doing a fantastic programs for the spreading knowledge about autism to the general dentist as well as the specialists across the country and across the globe. And in this connection, today we are here in the webinar where Dr. Sunil is going to speak on nutrition puzzle, which is to be solved. I'll take this opportunity to congratulate Dr. Sunil and also would like to introduce him. Dr. Sunil Babu Kotha is Assistant Professor in Pediatric Dentistry, Program Director, Department of Preventive Dentistry, College of Dentistry, Riyadh. Ulm University at Kingdom of Saudi Arabia. Also, he is the adjunct faculty at the Department of Pediatric and Preventive Dentistry at Sharad Pawar Dental College at Wardha, India. Dr. Sunil Babu, before going to Riyadh, was working at Mamta Dental College, Khammam in India, and he has graduated from Kelly Institute of Dental Sciences, Belgaum, in the year 2001, and followed it up with his master's in pediatric dentistry from GTC Hyderabad in 2006. Dr. Kota is a life member of the Indian Society of Pediatrics and Preventive Dentistry, as well as the life member of our own Federation of Special Care Dentistry. He is also a regular member at various associations, which include the Arab Society of Disability and Oral Health, Saudi Dental Society, International Association of Dental Research. Sunil Babu has supervised undergraduate students where they have awarded first prize in the first Saudi Dental Education Conference held in Saudi Arabia in 2018. He also won the Best Poster Award in the first International Association of Dental Research Saudi Arabian Division Research Symposium in 2020. Dr. Babu's area of interest include early childhood caries, minimal intervention dentistry, special care dentistry. He has various international and national publications and has contributed chapters in textbooks as well. Continuing with the program, the FSCD also is proud to say that it has been associated in the Guinness Book of World Record, which has been created on 7th April, where along with the Special Olympics Bharat, we have screened special children across the country. Around about, I think, more than 75,000 special children have been screened. And all credit to organize this program should go to our President, Dr. Srinivas Namineni, and our General Secretary, Dr. Priya Verma, for steering this, I should say, Herculean task across the country to such good results. I congratulate all the members of FSCD on this achievement, and I hope they all strive to work for the special care dentistry in the country and around the globe. I request Srinivas sir to say a few words.
Thanks very much, Balaji, and it was always wonderful to hear Dr. Sunil talking about this very own topic. And on the behalf of Federation of Special Care Dentistry, we're always happy to provide a forum for children, the parents, and the clinicians, and make the connection which was missing all these years. I also take this opportunity to congratulate the Autism Board under stewardship of Dr. Shambat. They're doing a wonderful job. The number of programs they have organized, the kind of awareness they're bringing, and they're showcasing the Federation of Special Care Dentistry in every form and every form. Thanks very much for taking your time off in attending this webinar. And I also thank Dr. Sunil, very close friend of mine, for sharing his immense knowledge in this area, which has not been covered much in the past. So I welcome each one of you to take home a lot of messages from this webinar. Thank you. Back to Balaji.
Thank you, sir. Dr. Sunil, we are eagerly waiting to hear you on nutrition. I'm sure that it will be a wonderful presentation and knowledge to be gained by us.
Thank you. Thank you so much, sir. I'll just share my screen. Is the screen visible? Is the screen visible?
Yes, not the full form, only that. You can go for full screen.
Yes, sir. Yes, sir.
Yes.
Am I audible? Oh, that's great. Thank you. Thank you so much. Yeah. First of all, thank you so much for the wonderful introduction. Thank you, Shambat sir, Dr. Balaji, and Dr. Namineni sir. for the introduction. So I'll right away start the presentation. This is Sunil Babu Kotta. I think you got enough information about me. So I'm here today to present nutrition, a puzzle to be solved by the for children with autism. I come from here, I come from past a decade. I have been working at this university, Riyadh Al University. These are my campuses where I work. And I can say it's my second home right now regarding this university. And so coming to the topic, actually speaking, I think when we started our topic, it was like I was discussing with Dr. Shambat sir, like, should we take to the parents or should we take to the dentist? So basically that was a question arised, and in our meeting, and so we have decided, okay, why not we go to the parents? So since that is where we need to first give the awareness to the parents. So what I have done is at one point after the meeting, I've contacted a lot of parents and the dentists also, because when I started reading, I felt like, to be frank, it is, by the way, if any mistakes or anything, please do excuse, because frankly speaking, this is a topic very much less we will get into it, because we always talk about the knowledge about the autism, knowledge about the habits and whatever. So once I went depth into the subject, and when I was reading everything, I'm like, okay, fine. I contacted a couple of parents, like I can say around 10 to 12 parents or so, who are the parents of my patients and my friends. And then I have given a small, like a question, like just the basic terms. Okay. Like I have done a sample not less than around 40 to 50. So I just asked, like, do you know these terms? Like, you know anything related to this? Then they were like, most of the people were very much comfortable and they know everything, because most of them are educated, and so they know, because it's for their children. So that is why they dug into it and they found out the knowledge and everything. And at one point I felt that I know less than the parents, to be frank. So then I am like, okay, why not check among the dentists, where I was really surprised that most of them, like I can say, I should include myself also during that time, it's like very less knowledge. I cannot say very less, but very less information related to this. So then I contacted Dr. Shambat sir, and sir also was like, yeah, this is true. And I totally agree with this points. And so then we decided, why not to go with the dentist? So basically, I just want to, because there are points, there are things as a dentist, which I think mostly the nutritionists and the pediatricians will look into this topic maybe. So if any points related to this or so to go into depth, yes, I can give information related to this if I have not able to cover in this 1 hour. Okay, so coming to the topic, what exactly is the autism? We all know that autism is an innate inability to create normal, biologically determined and emotional contact. And we know that they don't interact with the people. They have repetitive disorder, and every person, like autism is different in the other way. That's the reason it's also described as spectrum or continuum. So then this is the definition actually, which was recently given by Diagnostic and Statistical Manual of Mental Disorders, updated into a single board autism disorder, and the identification of 2 domains of impairment: the social communication and interaction, and restricted repetitive behavior, instead of 3, which was the previously, like the Diagnostic and Statistical Manual, the previous edition. So coming to the prevalence, I just didn't go much into this, but I'm just telling the basics of this. Like roughly 23 out of every 10,000 children in India have autism, according to the first rigorous estimate of country's autism prevalence. And this rate, about 0.23%, is far less than 1.747 percentage in United States. It's more common in the boys, and the frequency is increasing nowadays. Basically, what according to the evidence, which shows that it is not increasing, rather the education related to the autism has been increasing, and the investigations and the behavioral, diagnostic criteria has improved. That is the reason maybe it is seen as the autism is increasing nowadays in the present population. So coming to the nutritional considerations, is there a link between these factors and autism? The diet, nutrition, GI tract, and the feeding issues. Yes, as like a lot of, I mean, the connection, the link between them, which I'm going to tell in the future slides. So the food plays a major role in the three distinct areas. I divided the topic into these three topics, like how the autism is developed because of the food. And the most important is the manifestation of the symptoms, which most of us will be experiencing, or the parents rather, I can say. But as a dentist, we should know what exactly are the problems the children are facing related to this, and the treatment to this particular condition. So coming to the causes of this, it's like broadly, as you all know, in our theoretical, in our subject, we always tell there is no specific cause about autism, and I truly agree with that, and broadly divided into genetic and the environmental causes. So much scientific research has indicated that pathogenesis of autism may have been a beginning already in the fetal life. As you all know, that maybe because like specialists should take a special need for metabolic disorders, which can increase the risk of ASD in the children. And one of the dietitian's tasks are to properly assess the nutritional status of the mother before and during pregnancy, thereby allowing the changes in the nutrition where we can reduce these metabolic indicators, and the chances of autism can be reduced. So the hypothesis here is that there is an interaction between the mother's nutritional status and the genetic factors. I think this is very commonly seen in the pregnancy, the type 2 diabetes and the gestational diabetes. But the percentage, like over a long run, and an uncontrolled diabetes might lead to the autism in the offsprings. Okay, then coming to the maternal obesity, the risk is increased by 21.5%. So these are the things actually what I feel like as a dentist, like we need to keep these things in mind, like to spread an awareness among your relatives or among the population you visit. Like these things you need to concentrate on and try to educate and giving the awareness. Maybe that's one of the reason I've been like, why not first we dentists know it so that we can give the information to the near and dear around us. And the third point, which I was really surprised, but yes, the sample size was less and more investigation is needed. Even the paternal obesity has a risk factor for autism. So it is like thank God, these things, like it's always we should know the research what we have, like we need to look into. Okay, so the paternal obesity has an odds ratio of 1.53. And the hypertension is also a risk of autism in the child, which rises to 14.3%. Okay, these are some of the wonderful studies which I can put through, like the mother's interaction of mother's nutritional status and the genetic factors. And there's the acute phase response during pregnancy resulting from the infection and toxic exposure can disrupt the fetal micronutrient availability, leading to, again, defects in the CNS development and can develop into autism. I'm very sorry. I'm going it's more of a theoretical aspect, which I cannot make it applicable because the topic is such. So this is a why nice. You can take a screenshot of this, the paternal, the prenatal and the postnatal exposure, the genetic susceptibility and the environmental factors. So then coming to the manifestations of the symptoms, like we all know when we have read, like we all know these terms, like particularly the picky eating, the pica and all these things. So these are very important terms in terms of nutrition for the children suffering from autism. So the picky eating, as you all know, reluctance to eat familiar food and try new foods. So they are scared of neophobia, taking new fear of trying new foods. And it is also, the term can also be used as a selective food intake, the part of picky eating. Eating an inadequate variety of the food that occurs for many reasons, such as sensory sensitivity. I'll come back to that later regarding this. And avoidant or restrictive food intake disorder, okay, extreme form of picky eating and selective food intake. Actually, this is the area, frankly speaking, there is no much research was done among the autistic children. I know we have less exposure to the autistic children, but still in terms of nutrition, if anyone are interested, I think this is the area which you can go into. The pica is characterized by the persistent eating of non-nutritive, non-food substances that are not part of cultural or social normative practices. And this is also a new term which I have come across. I mean, in autism, in the children with autism, the food is swallowed and then brought up into the mouth and either rechewed or ejected or re-swallowed. Okay, these are some of the definitions related to the nutritional aspect for the manifestation of the symptoms. And it was found that about 25% of the healthy children are picky eaters, while about 80% of the children with autism demonstrate selective eating tendencies, where I'll come back to the experiences what I have got with the parents whom I have spoken related to the nutrition, basically not related to dentistry. So I had to talk to them in person, so to understand how the children act in relation to this. And it was found by Mace and Zigraf found atypical eating behaviors were 5 times more common in youth with autism than children with other disorders, and 15 times more common in autism group than their typical developing peers. So it is this atypical eating behavior is a very big concern. As I told you, with the experience what I have faced with the parents, it is this is a very difficult task for a parent to deal with. And I have seen almost 99% of the parents are like, they have left their work to make the child eat all types of food. So it's not that easy to deal with this particular area for the children, but definitely not impossible. It is basically, he's a child and he need to be trained. So according to some estimates, about 90% of the children with autism process tactile, olfactory, visual, auditory information differently from normally developing children. So it is like, I say, frankly speaking, after reading about the children with autism, they are very calm and composed. Yes, they have some social interaction issues, but there are enough children who had cope up with that particular area with the support of the parents and the caregivers, and they have overcome lot of issues, and they are actually the wonderful kids we see. Okay, and the possible explanation for why certain nutrients are less readily absorbed in patients with autism is the difference between the gut microbiome in patients with autism and their healthy counterparts. So this, I'll come back to you related to this particular area. So coming to the gut issues, okay, gut issues, the health of the gut microbiome is directly related to both gastrointestinal and neurological symptoms of autism. And the disruptions of the gut microbe can affect the gut motility, and consuming certain types of food may directly exacerbate the symptoms of autism. And the diet, actually, I felt like this diet and the gut issues plays a major role in what all we speak about the repetitive behaviors, or the like in terms of the child is very restless, the child is very like he cannot concentrate at one area, he cannot sit at one place. There is nothing to be blamed. Very like I can say a percentage of blame for the this condition is mainly because of the food and the gut issues that I think most of us should know. It is not that the child is very adamant, or child is very like is not cooperative, something related to neurological, nothing. It is mainly 90% of it, 95% of it, the mainly because of the gut issues. Okay, these things need to be concerned about. And the children with ASD are prone to food allergies. This is very common. And the allergies can cause physical symptoms such as diarrhea, vomiting, hive, wheezing, and the rashes, which are actually speaking, it's very much more in certain population. Okay, and the children with ASD often have a trouble communicating. So they may not be able to tell their parents that they are experiencing painful symptoms of their allergies. That is where the parent and the caregiver plays a major role, where they need to identify that particular area. And the discomfort, pain, and the other physical reactions from the allergic responses could trigger the autistic behavior. So you can see here, like this is one thing which I have come across. One second. Okay, fine. So before going into this, I just want to talk about the points. Like I was talking about the food, the allergies, and these things. I've been seeing like one of my friend who have a child with autism. I've been discussing with her. It's like, where exactly, like where is the problem? What happens to the child when he's eating certain food? Look, like she gave an example. Like for example, if I give like when he sees a beetroot or anything, he's like well away from that because of the color. And she had already fed the beetroot along with the salad what she was giving. That beetroot is one thing because of the color or so. The child was very like, after eating the any salad with having a beetroot, I'm telling just an example. Okay, the child was very hyperactive, and he is very hyper, and is very difficult to handle this child at that particular point. And once it is controlled, everything is come in line. So, and he used to get rashes, he used to get this one with certain types of food. So these are all the things where we need to keep into consideration. And the gut issues, the gut microbiota, and the opioid axis. Actually, this leaky gut, I don't know, I have read very like long time back, but it's Dr. Shambat sir, actually he discussed with me like this is a very important area. This is what we usually see in the children in this this particular concept. Like for example, the leaky gut, because of the microbiome within the in the gut, There is increase in the Clostridium difficile and the Candida albicans, and reduction in the bifidobacterium and the lactobacillus. So basically what happens is the because of these microorganisms which are which are increased, like for example Clostridia or these increases, basically it generate the propionic acid. Okay, the propionic acid which is increased, these are what I can say, it disrupts the production of the neurotransmitters. Okay, so what happens basically, because of all this, the peptides in the stomach also cannot be digested properly, and because of the leaky gut which happens in this particular children, okay, which escapes and crosses the blood-brain barrier, and it has a action of an opioid. Just imagine a child or anyone taking opioid. We know that the child, it's the function of the opioid, it becomes high and everything. The same thing happens for the child, unfortunately, or any children with autism. Okay, so this is one of the concept of the leaky duct, gut, which happens for the children. That is why it's very, very important in this particular area for the child, that we need to look into like which nutrition or which diet we need to give, and it should be very much careful because of the behavior of the child. So then coming to the sulfation system, this is one system, like it is like the phenol sulfur transferase enzyme, which actually detoxify all the internal and the external toxins produced in the body. So what happens in the child with autism is that this detoxification doesn't occur. Because the sulfation system is a vital maintaining the mucous membrane of the gut. And here what happens, there is increase in the gut, the internal toxins and the external toxins. This lead to a leaky duct, which allows it to reach the blood and cross the blood-brain barrier, and the opioid effects are seen. So the sulfation system is so commonly used in our body that even the commonly used paracetamol is being cleared by this. So none of the toxins have been removed, and even the problem is the motility of the gut is also reduced in this particular children, where the clubbing up of all internal and the external toxins leads to the opioid-like effects in the children. So basically, if you look into all this, and so it is the gut and it is the food which is making a lot of difference. So then coming, as I have been talking about, the gut issues could lead to multiple reports describe chronic GI function symptoms in 9 to 84% of the children with autism. Constipation or diarrhea, abdominal bloating, discomfort, irritability, GI reflux, or vomiting. And the pathological finding includes because the inflammation of the gut abnormalities of the enteric nervous system comprise the gut microflora. The basic problem is the microflora is completely changed in the gut, where the normal process cannot be happened because of the gut issues which happen, the pathophysiology which happens in the gut for the children with autism. And coming to the treatment of this condition, I cannot tell that there is no, I can say that there is no specific treatment as such for the autism. But I can say every child is different. That's a reason, that the autism is called a spectrum or continuum. So I feel like it is not the medicine. He or she are not suffering because he is having some neurological issues. Definitely not. It is mainly the nutrition, the diet, what we are taking is making a lot of difference. If we as a dentist, we have much less exposure maybe for the children with autism, but uh, it is our duty as a responsibility as a healthcare professional that we need to rather give an awareness rather than giving a treatment. Definitely, we are not going to give a medical treatment for the children, but at least the awareness in to the parents or the caregivers whom you visit, or any pregnant ladies or so, that is where you can look into. And treatment, I actually, like, to be frank, there is a lot of treatment. Like, there are various diets available in the market. Frankly speaking, there are many diet regimens are there. But I felt like these are certain areas where we need to look into, particularly the gluten free and the casein free diet. Like, as I told you, I was talking to the parents, and so 80 to 90% of the children with autism will have this gluten-free, casein-free diet, because it's like, as I told you, the gluten diet and the casein diet releases the peptides, which cannot be absorbed or cannot be metabolized, so which reaches into the blood, and again the crosses the blood-brain barrier and causes the opioid effect. Because I have spoken to a couple of parents also related to this. Like, they stopped giving the chapati, like the roti what we give, the wheat. They stopped giving. The children like it, but unfortunately they have to stop it, this one, giving alternative diet. And the casein free diet also, there is the milk. The child cannot drink the milk, but there are other milk, like I've heard about the badam milk. They are commercially available products, but very important that see to that the gluten and casein free should be free from that particular diet. Nowadays, the market, they are like, even the oats, the cereals which are available in the market, you still have the gluten free diet, the oats and the cereals which are available for the children with autism. And also the specific carbohydrate diet. Basically, the children with autism cannot able to break down the starch or the complex carbohydrate. So it's always good to give a specific carbohydrate diet, monosaccharides for the diet. That can actually help. And the vitamin and mineral supplements are very much important. Like, as I have told before, these are the areas where the children have, because the children basically are picky eaters and selective food eaters. I was again talking to the parents. They are like, they love the French fries. You all know they like the French fries, and they like the same color, texture, and and even the brand. Okay, I was told, like, one of the parent is like, they love to have the McDonald's fries, so that the packet of the McDonald's is always with her. So whenever she want to give anything related to this, he loves McDonald's. So whatever she want to give, she used to keep. She always used to keep in that McDonald's box. So they are very much particular about these things, and the basic nutrition, the micronutrients, are not received to these children. So that is why the vitamin and the mineral supplements also should be given. And the low oxalate diets, because again, the child cannot take the salicylate the diet, because I have already discussed about their digestion related to this. So it's always good to give a low oxalate diet, which is very much the good for the children in terms of digestion and so. and less chances of this hyperactive conditions. And the probiotics, as I told you, the gut microbiome is compromised in these children with autism. So, and these are all the things, of course, as a dentist, we are not going to give all these things, but in terms of treatment, these are certain areas which you need to look into, and all of this should be taken after the consultation from the physician. And because I have seen parents, they'll be like I started giving him probiotics. Like it's not, we need to give an awareness, because it's very common for everyone of us, like even us, when we are taking the self medication. But I think this is what also, as a healthcare professionals, we need to educate them not to take the medication just because it's available in the market. So then coming, like, what is the action plan where the parents and the caregivers can take? The daily diet chart and observe the changes in the child. This is what I have observed, is that, like, first thing is, you need to understand, like, what exactly is there, like why the child is not accepting. Like I know the mother, the child is right now around 5 to 6 years, and the child was not eating many fruits and vegetables, which is very important to be given to the children at this particular age, because of the for this particular condition, because of the nutrient deficiency what he has, because of the picky eating and the selective eating. So the basically the best thing to do is introduce one new thing at a time, because the child takes a lot of time to cope up with this. Like, I've been seeing some of the videos related to this. Because of the consistency of the food also, the child will not accept. So it is like for example, if you want to give any tomato, for example, the consistency of the tomato, if it is soft or so, the child may not like it. So it was told in one of the like I've seen a couple of education programs for the parents and related to the nutrition or so, where they have actually squeezed the tomato, and that they have painted on a chart with the tomato, that juice of it, so to get used to the consistency of it and the color of it, or the texture, according to the child, the problem, the issue about it. Okay, and you need to know the ingredients before serving. It's always better. It's like, I can say that it's always not good for a child to be taken to a supermarket. Even if he is taken, like, he need to educate, like, we need to show him in this, like, this is very difficult to handle. It's very difficult to hold the child not to take to the supermarket, but it need a big exercise and a task for the parent in relation to this. And if, for example, if you're giving any new supplement, okay, so it's not like, don't get excited, like you need to give, no, you need to eat fruits and vegetables. And so it takes a lot of time for the child. Like it like every new ingredient, it is said that you should give at least 3-week time for the patient, for the child, okay, to get accustomed to that. And then you start with the new thing. I still remember in Hyderabad, I went to one autism center with Dr. Gayatri Moge. So I was there for a couple of days in that center. The time needed for them to keep a toothbrush in the mouth, it will take not less than 3 to 4 weeks, because he is not comfortable. They'll be touching the motor skills. They are improving the motor skills by touching the toothbrush on the cheek and slowly entering into the mouth. So just imagine the food taken into the mouth. It's very difficult for this child. And don't forget that gluten and casein are often found in non-foods. Screen your washing up liquids, shampoo, soaps, toothpaste, and the lip balm. And why not even our dental materials? Okay, so it's a very good area of research in terms of composition of the dental materials, and look into any thing which has more of these composition which could affect the autistic child, child with autism. And remember that it can take up to a year to get rid of the traces of gluten from the system, while the casein disappears within few weeks. And take all artificial coloring, preservatives, flavoring, natural or artificial out straight away. Because this is, again, I told you about the, in regards to the beetroot. The child right now cannot even able to eat, touch, see the beetroot, particularly when it's cut. So it's very important for us to look into these issues when the child, when you see the child with autism. And this one, the food to avoid, and these are the general foods which I've mentioned here. I'm not going into detail because of the lack of time, but a lot of information which is there. If you need anything, I will definitely provide you the information. And the concerns and the intervention, how to improve this diet. Like, for example, you want to give a fiber intakes, increase fruits and vegetables, increase nuts, flax seed meal, and the calcium and vitamin D intakes, use fortified dairy alternatives, as I've told you before, and increase use of non-dairy calcium sources. And the iron and zinc intakes, increase use of meat, beans, and fortified food. And also, like, the children are very much like they have very less of magnesium, very less of potassium, and these things are very important to be supplemented in a different form. And I would like to conclude this presentation, and as many claim nutrition causes gastrointestinal problems in autism, causes suggest it is not just a psychiatric disorder, but has a psychological base, and elevating this gastrointestinal problems could help and ease the symptoms of bringing out much needed overall improvement in the affected victims. So what I want to say basically here is the gut issues plays a major role. The gut issues is related to the nutrition and the diet, what we are giving to the child with autism. So it's very important you concentrate on the diet. Like I have after discussing with around 30 to 40 parents, like not less than that, both here, I mean, in Saudi Arabia and India. And I found that the parents right now are very much getting educated, and they are knowing, because of the many autism centers, because they are now knowing how to deal with this child with autism. Like because the education, but still the awareness need to be improved. And as a dentist, it is our responsibility, how much ever we can go into it. And this concludes my presentation. And these are some of the books. Thank you to Dr. Sukumar sir, who had given like a lot of, these are some of the books he had given. Like, frankly speaking, I had gone into autism and so, and but still I feel like a lot to be known, maybe because of the topic, which is not much related to the oral cavity, and not related much to the dentistry, which is really new to me. And you can generate a lot of research in this particular area. And at last, I want to thank the FSCD team and my university where I am working, and all the senior faculty in the FSCD. Thank you, Dr. Priya and Dr. Malineni, the founders for the FSCD, and all the senior FSCD members. Dr. Naminin sir, Dr. Balaji sir, and Dr. Shivkumar sir, and all the other members. And it would like incomplete if I would not thank my chair and the vice chair, who had given an excellent support and for this presentation. And I should also thank the autism team members, the board members who had been like given me this approval for me presenting this particular topic. And special thanks to Dr. Shambat sir, because he have been discussing with me in related to this particular area and so. And thank you, everyone. And if any doubts, I can go ahead with this. Thank you.
Thank you, Dr. Sunil. Very informative and a topic which most of us shy away from, or rather the shying away is because we do not know anything about
Exactly.
autism, as well as the diet of the autistic child which has to be taken care of. You explained so beautifully. The floor is open for questions. I had asked if anybody wants to ask questions in the chat box, but right now I am not seeing any questions, but only what I can see is accolades for you and appreciation for you. Coming from Pavani, Dr. Vidya, Lalita Jairam, Ido Nova, Sid, Padmanabhan. Shambat sir, I request you to take over from here.
Yeah.
First, sir, there is a one question, sir, just now has come up.
Yeah.
Sorry to interrupt.
Please,
Yeah.
please go
Balaji,
ahead.
sir.
Yes, I can read that. A question is from Dr. Venkat. Nice lecture, doc. What are the vitamin supplements you would usually recommend for autistic kids?
It's like regarding the vitamin supplements. It again, as I told, the physician, the pediatrician who is the one to decide. And these medications, we can go with the multivitamin medications, but still I prefer, rather than the vitamin supplements, it's a diet which we need to modify, which gives the better impact on the child. But yes, the vitamin supplementation should be taken, but of course from the physician suggestion. Mainly, mainly about the vitamin D, which is very much common, and the vitamin A. Okay, so these are the basic vitamins, and vitamin B6 also. So all the vitamins need to be supplemented also.
Okay. But more or less the requirement of vitamin in autistic kid is more or less same as any normal child.
Definitely. And one thing I kindly want to add, like the child, only because of the gut issue. To be frank, every child is a picky eater. Okay, it is always about the training. But frankly speaking, when I spoke to all the parents, I find that the children with autism have more systematic approach in their food, rather than the children who say that, okay, the child is free from autism. And this one, I feel since the nutrition is very important aspect in terms of health issue, I think the children with autism are more healthier than us.
There is a question from Pido Nova, but I think if Pido Nova reframes the question, we would be able to understand it better. I request Pido Nova to write it again. One thing from Pavani Tota: association of diet and autism is a functional medicine purview. It is very difficult for a dentist to get convinced with condition of the gut microbiome is the key in autism. So testing can diagnose any imbalances in gut bacteria as well as leaky gut.
Yes, a good information. That is true. That is what I've been telling you, because that particular area, we are not in that particular area, to be frank. But the intention for the autism board, and in specific Dr. Shambat sir, is this, that you as a dentist should also know about this, because a patient is not cooperative to you in the clinic. So don't, at least see, this is one experience what Dr. Sham sir has told in his practice. Like, a child comes after drinking milk. He comes to the clinic, the patient becomes hyper, very uncooperative. and there is, because of the allergies, the vomiting in the clinic also. So as a dentist in this particular area, you can actually tell if you are giving appointment for any child with autism, tell them to specifically tell not to feed this particular diet and come. So that is the only area where we are connected in this particular topic.
Okay.
I think Sham sir can add certain points related to this.
Dr. Sunil, you have done really a good job, and it made it so simple for the people to understand. When you go to the deeper and deeper, it makes you really interesting the topic. But at the end of the day, it's not easy to understand the topic, to answer to everything, because parents are best people to answer for this. You are neither individually, it's not difficult because each one differs in this.
Yes.
Only I just add with this here is some of the things which is carbohydrates and the things which is going to change their behavior. You can reduces the anxiety or such things. We have to make them, parents has to support the children, not we cannot do that part of it. They have to do their child, they know how, which one is going to irritate, which one increases their behavior. Or some of the people, they are recently in the where we have conducted the autism awareness program, what one of the parents mentioned, constipations is a very difficult thing for a dentist to answer that.
Yes.
Constipation, obviously the medical supports, but the parents, they know in depth of what subjects to answer, and that they have modified the child to behave for the constipation, how to come out of that. Now, second question is bowel movement or maybe the abdominal pain. All these things can definitely, parents can change their diet, then they can come out of the difficulties. Only thing is, again, whichever the things, sugar intake, all these things which is answered for us also oral cavity part of things, which we can address it. I think this is the topic. For the other things, for body weight gaining, all this can be addressed in a different setup, or maybe in another platform we can discuss further.
Yes.
Dr. Shivkumar is there.
One more question is there. Actually, Pedonova has written the question directly to me. Family who has lower social economic status, is there any diet plans and supplements provided under the organization? So it's a big question for all of us in the FSCD to ponder over this and think about diet plans and supplements. Dr. Kotha, anything supplements you have already told, and diet also you have told, but maybe it's a avenue where we can think of, Sham sir, what we can do about
Dr. Balaji and Dr. Sunil, I think this topic, yesterday I spoke with Dr. Pooja also. She's Pooja is actually practicing in Delhi, in the Greater Noida. The same topic is discussed with her. She is coming out with the same topic now. We'll see, we'll discuss, and then we'll come back to you people how we can address that.
Right. Thank you, sir. Pedonova, I hope you have heard the answer from Dr. Sham, but probably something is in the pipeline.
Before that, Dr. Balaji, I'll welcome Dr. Shrikant Malnini and Dr. Shivkumar are in the today's webinar. I'm really happy to see those people there. But Dr. Shivkumar is always supportive for all the programs, as well as Dr. Shrikant.
Sir, you are mute, sir.
Good afternoon, sir.
Good afternoon, Shivkumar sir, and good afternoon, Malini.
Dr. Shivkumar, anything can be added, Dr. Shivkumar and Dr. Shrikant?
Shrikant, good afternoon.
Good afternoon, sir. Nothing, sir. It went well. Congratulations, Autism Board.
Thank you.
Thank you, Dr. Shrikant. Thank you very much.
Kumar, sir. Nothing. We are muted by the host. Okay. Host, can you unmute Dr. Shiv Kumar, please?
Now he can unmute himself. Yes.
Dr. Shiv Kumar, you can unmute yourself. Yeah.
Okay. Thank you. Like everything is covered by Sunil.
Thank you, sir.
Maybe as Shambhat sir told, in the future we can actually deliberate more on this particular topic.
Yes.
Okay, sir. Thank you.
I think Dr. Vidya, anything to ask? Dr. Vidya, are you there?
Thank you. Very well covered. Most of the behavior of the children, I think, is influenced by their not only autistic, by the regular children also. So parents can pick up some points here and.
In fact, she has already mentioned in the chat box that nutrition can affect any behavior. It is not just about special children; it is about the normal children also.
Yes.
So all of us have to remember this point because nutrition actually affects the behavior.
Yes, sir.
Even normal children. So nutrition is very much important in day-to-day life also. Yeah.
I think Dr. Balaji, I think yes, we can congratulate Sunil and we can close the today's webinar.
Right. Thank you, Dr. Sunil, for the wonderful presentation. I hope all the participants right here on Zoom platform as well as on YouTube would be highly benefited by what you have deliberated. I thank you very much on behalf of FSCD, on behalf of our President and Secretary, and all the members of the association. Very hearty congratulations once again. The chat box has already got the link from where you can download the certificate. Sir, is there any appreciation certificate to be shared here?
We'll deliver. We will give directive in the end of this month.
Okay.
All will the month end program will be there. That time will.
Okay. So, Dr. Sunil, thank you very much.
Thank you so much.
Maybe
Yeah.
if you want to say a few words before the closing.
Yeah. First of all, again, I should thank the FSCD team and congratulations for the whole team about the Special Olympics Bharat. It's very nice to the whole team getting into the records, and I am in touch with some of my friends who are being the participants in this one. Wish I was in India. I would have been definitely an active participant to be the part of this success. And regarding the presentation, and so I hope like certain information have been got into, like for information have been reached for you, so that we can deal with in the future. If any child comes to you, at least educate the parents in terms of the nutrition. Rather, the parents know better. At least we need to know the more from them. So thank you so much, and thank you, Dr. Shambat sir and the autism board members for giving this opportunity. Thank you once again. Thank you, Balaji sir.
Thank you. Thank you very much.
Thank you, Dr. Balaji.
Thank you, sir. Thank you.
Thank you.